Okay, so hi everyone. This is the second addition to the new initiative to Psychwithshri, where I'll be interviewing teen mental health specialists like Dr. Perry Bell here to gain a better understanding of the therapy and intervention side of teen mental health. So today, once again, I'm joined by Dr. Perry Bell, a psychologist at the Center for Child and Family Development Mental Clinic in Morristown, New Jersey. With a deep-rooted passion for helping those around him, Dr. Bell specializes in the treatment of children, adolescents, and families with a focus on the teaching and acquisition of skills to manage the emotional, cognitive, behavioral, and interpersonal demands of life. So thank you so much for joining me, Mr. Bell.
Happy to be here.
Yeah, before we start, I would love to just know, could you quickly introduce yourself to the audience and maybe explain why you chose a career in psychology?
Sure. So my name is Dr. Perry Bell. I'm a child family psychologist here in Morristown. I'm rare in the sense that I knew I wanted to be a child psychologist when I was your age, when I was in high school. And part of that was being the oldest of 5 siblings and always being in a little bit of a parental role. And so emotionally, I always had this inclination towards helping people and being in a leadership role. So from that perspective, it was sort of natural. On the other side of things, in terms of the science and the academia behind it, I really enjoyed understanding people and learning about the human condition, what makes people motivated and what makes people feel good. So both of those things together led me down this path.
Yeah, that's actually really inspirational, and that's kind of the path that I took to be more interested in psychology, so it's really cool to hear. So going off of that, considering your career of psychology, could you explain like a typical day being a psychologist?
Sure. So everybody does it differently. You know, when you're seeing patients all day, it can be taxing, both in terms of your focus, your attention, but also emotionally you can be drained because when you're meeting with somebody, you really want to be present and you want to be able to give of yourself to the person. Mm-hmm. So the way I break it down is I try to see people in blocks. So in the morning I have a block, in the afternoon I have a block, in the evening I have a block, and in the middle of the day I take a few hours in between for myself. So that usually for me means I'll go to the gym, I'll shoot hoops, I'll work out, I'll read, I'll make lunch. That's the only way I know how to get through the day because you have to really know how to pace yourself. And before this interview, you were telling me that you run cross country, so you have to pace yourself in running, but also when you're meeting with people.
So like that's like your kind of way to have a mental health break of your own and kind of like relax. Yeah, because obviously this is a very taxing job when you have to hear like the struggles of everyone else. So that's great. And could you briefly just explain what kind of education and training you went through to become a psychologist?
Sure. So for if you want to become a psychologist, generally speaking, you want to first get a degree in psychology in your undergrad. Yeah. So I'd done that, and in order to get into a doctoral program, there are certain types of training experiences that make you competitive to get into a program. So that includes practical experiences. So I had done a lot of work in mental health in college. I had done work with kids with disabilities. I had volunteered in mental health programs through my university. So that gave me some interpersonal experience. And then also doing research. So I was involved in three different lab research experiences when I was in college. And all that together led me to get into a doctoral program. I did my doctorate here at Rutgers in New Jersey, which even though I'm from Morristown, I went to college in Boston. I came right back to New Jersey. And in graduate school, you're doing a lot of the same, but it's more in depth. So you're doing a lot of clinical work and you're doing a lot of research at the same time.
Okay. And what are some of the research that you did? I'm just kind of curious.
Sure, I did a lot of different types of research. For me, the bit of research that brought me into this specific niche of what I do, which I guess maybe I'll share later, social and emotional learning. I worked in a social emotional learning lab. What we would do is we'd go into struggling school districts in New Jersey, and we would help the teachers learn how to teach their students social and emotional skills through their teaching. And then we would measure how the students improved in terms of their behavior and their academia. And I found that to be very fulfilling and very motivating. I enjoyed it a lot, and that put me on the path of emotional intelligence work with children in particular.
Wow. Okay, that's really cool. You can, if you want, you could go ahead, because that's going to be another question anyway. Like, what exactly is the emotional intelligence work that you do? Like, what within this niche do you use every single day?
Sure. So I guess the first question is what is emotional intelligence, right? So emotional intelligence is the ability to navigate life through knowing what you feel, knowing what somebody else feels, and making good choices that both improve interpersonal relationships, but also help you achieve your goals. Now, if you don't have an awareness of what you feel, and you don't have an awareness of what your motivations are, you tend to go through life in impulsive ways. And when you're going through life in impulsive ways, you're not making choices that really benefit what your goals are.
Yeah.
So when we talk about emotional intelligence, we talk about 5 general categories. I'm not going to go through all of them, but I'll go through the 3-step process that I work with everyone on, which is the ability to label or know what you feel, said differently, being self-aware, being able to tolerate an uncomfortable feeling, and then once you tolerate that uncomfortable feeling, being able to make a choice towards what's best for you. Now, if you don't know what you feel, you can't tolerate what you feel, and if you can't tolerate what you feel, you can't make a good choice for yourself. So I have a language that I use with children to help them understand those concepts and help them work through their feelings. And what I do a lot of is helping parents help their kids in the moment work through how they feel. So the truth of the matter is that the real work of social emotional development and emotional intelligence, or what we call emotionally intelligent parenting, is not done in this room. It's done at home. And what we encourage parents to do are to use these skills at home to help their children. And then when they come in, we discuss what those experiences are and we teach new skills.
Yeah, okay.
And that's our
yeah, and that's probably the most effective too, because they already have some experience. So yeah, that makes sense. Okay. And okay, so going back to your job, what do you find to be the most rewarding and the most challenging part of your job?
It's a great question. In terms of what's most rewarding, I find the relationships. I mean, I've been working, there are certain children I've seen grow up from the time they were 6 or 7, and now we're sending them off to college, and watching a child develop over the years and seeing, I have one kid who just came back from a trip abroad, and he was petrified since he was a child of sleeping apart from his parents. We worked on sleep and anxiety for years and years and years, and he just went on a 2-week travel experience without his parents.
Wow.
There was a lot of anxiety associated with it. We talked about it for maybe 6 months, prepping him for this experience. And when he came back, I just met with him this week earlier on this week. When he came back, it was unbelievable to see the progress he had made, and he had such an amazing time. So when you watch someone grow over time, it's incredibly rewarding.
Yeah, it's true. And what about the most challenging?
So I would say over the last 10 to 15 years, we're seeing a real increase in more severe mental health episodes, which would include things like self-harm or negative self-talk, or in its more severe form, sometimes people can have thoughts of wanting to hurt themselves or end their life. And we're seeing that in younger and younger children, and we're seeing it more frequently. So those are always challenging experiences, because if you can imagine sitting across from a 7-year-old kid who's saying, "I don't want to be alive anymore."
Yeah.
You take that home with you.
That is.
So those are challenging experiences, and it's challenging for the parents as well when they're sitting in the room. So I would say the most challenging part of my job are when those moments happen, which you can never anticipate. You're both attending to the child and the parent simultaneously.
Yeah.
And that can be a very challenging emotional experience. And then when they leave the office, I sit in my chair and I think, I can't imagine what they're going through it internally. It's really, so those are challenging, for sure.
Yeah. But it's great that they still have someone like you that they can, because it's exponentially more easy to handle something when someone like you is there. So it's still,
I hope so.
Yeah, I mean, I would think so. And just on the topic of child care and maybe even adolescent care, what are the most common issues amongst this age group that you see coming into your office?
It's interesting. It's changed over time. So if you were a child psychologist in the 80s and 90s, the buzzword would have been ADHD. That was the primary thing we were talking about and seeing. In the 2000s and the 10s and now the 20s, actually, let me speak more recent. I would say in the last 10 years, like I said, we're seeing a lot more self-harm, a lot more thoughts of not wanting to be here. That's more frequent and more recent, but the rates of anxiety are just unbelievable and through the roof. And I find that I'm dealing with anxiety all day long, and then also, of course, issues surrounding social media and gaming are pretty pronounced as well.
Do you think do you have any idea of why you think anxiety is on the rise?
I mean, it's never one thing,
yeah,
right? So it's a few things. Could be a few things. I don't know that I'm right, but I think in my own anecdotal experience, I think it probably has something to do with some pretty significant cultural shifts that we're experiencing right now. First of all, the obvious one would be social media.
Yeah.
And when I was your age, which is weird to say, but we at 2:30 went home from school. You had a break. We didn't have cell phones. You went home, or maybe we started having cell phones, but there wasn't a culture around phones the way there is today.
Yeah.
So you had a break from people from 2:30 until the next day. But now you don't get a break. When you're on social media, you're always interacting with people in a way that can be really unhealthy. Personally, I'm very weary of my own social media presence because I try to protect my own mental health. I know that a lot comes from those experiences, and I don't know that I want to expose myself to it.
Yeah.
Well, of course, I see the kids who are struggling with it, but I think on the whole, it can really affect people. I think also families aren't living in the same proximity in the way that they used to. So we're in a culture now where aunts, uncles, cousins don't necessarily live in your community. Grandparents, and because of that, we don't have the same types of social support I think as traditionally we typically have had in the past. I think that's also important. And then I think one last point, which I know that maybe a lot of high school kids are going to watch this, so that may get pushback on this, and that's okay because this is a conversation. But I think we're in a culture that says that is conflating fact and feeling. Very, very often when you feel something, it's not something you should be responding to. For instance, if you're scared to go into a social situation, that doesn't mean you shouldn't go.
Yeah.
Very often you should go. The fact in that situation would be, I want to be social. The fact would be, I have social ability, I'm likable. Those would be the facts. But if your feelings are, I'm scared, you shouldn't listen to those feelings. But I think we're living in a culture that says, do what you think feels right.
Yeah.
But really we should be doing what we think is right. If that makes sense.
Yeah, and it goes back to your talk about emotional intelligence. It's how you say you have to be aware of your feelings but overcome even if you feel discomfort. And I think that nowadays we are more society is more prone to just going the comfortable route, you know? You see fast foods, you see people on these social media accounts or on video games and things like that just indulged in dopamine. Sorry, that's just what I have seen, but those kind of things. And because of that, our society has normalized this, and so I think as a root because of that, we aren't open to going in directions that are more uncomfortable.
Sure.
So yeah, that's yeah, thank you for that. And that also answers some of my internal questions. So yeah, that's awesome. So going back to patient care, what's the process of diagnosing a patient and finding the best treatment for them?
It's a great question. So I'm a child psychologist. So when you work with children, the process is a little different because children develop in a non-linear fashion, right? So what I mean by that is a child will improve in certain areas and not improve in other areas simultaneously. So an example would be that prior to age 7, we don't actually diagnose most childhood issues. Because we're not sure if this is just normal development, normal developmental change, or a psychiatric issue. So until you're about 7 years old, it's hard to see. But even at 7, it's hard to really clearly see.
Yeah.
So a lot of people come in, they'll say, can you look at my kid and tell me what's going on? And to some degree, that's possible. But the truth is that you don't really get a good sense of what the diagnosis is until you've been working with a child across a good period of time. Until you see them across scenarios and situations. And before I was describing some of the emotional intelligence skills, like being able to know what you feel, tolerate what you feel, and respond to what you feel. For me, it's very diagnostic when I observe a child be able to or not be able to do those things. And if they're not able to do that to me points more to, okay, there's a real pathological clinical issue. If they are able to do it, I might say, okay, this is a part of development. It's a normal part of development. For instance, everyone has a little bit of anxiety.
Mm-hmm.
How do you know if that anxiety is clinical? Because they can't overcome it.
Yeah.
And that would be one way to diagnose. Well, that's how I think. Some people will, that's how I personally think it through from my own experience, because, if you come in here, let's say today you're having a bad day.
Yeah.
You might come in here and you might give me all the criteria that meet generalized anxiety or depression.
Mm-hmm.
But if you come back in 2 weeks, you may not fit those criteria. So a lot of times you don't really know if it's just a bad period of time, what we call an adjustment disorder, or it's a prolonged issue, which would then become clinical. And usually we think about that, we think of things in terms of 6-month periods. So if there's an issue that lasts 6 months, generally, we say, okay, now we can diagnose anxiety or depression. If it's less than that, we say, okay, they're just having a difficult time adjusting. Mm. But, I'd say one more thing on this point is that psychology right now is being pushed to be more medical.
Yeah.
In the field, we're and part of that has to do with insurance companies and a lot of other systemic influences. But the truth is that people are people, and people are complex. And in the way that you would diagnose a heart condition is not necessarily the same as you would diagnose a mental health condition, although there's really a strong, even in your question, and this isn't a fault of you, but your question presupposes a medical model, right? And I don't know that I buy into that as much as I used to, because I think that people are complicated, like I said, so diagnosis is needs to be taken with a grain of salt.
Okay,
That's the point.
And when do you think that people should come in with concern? Maybe they've had an issue for a week or a month. When do you think is the right time, or is there even a right time that people should come in and ask for help, even if they might not have an actual disorder or illness?
When it starts, so what I tell parents is that when it starts to impact your daily functioning, that's how we know that your emotional health has overwhelmed your capacity to cope.
Okay.
And when your emotional health overwhelms your capacity to cope, you need help.
Okay. So now going back to the treatment and diagnosis for these children, how exactly do you build trust and connection with these children? Because I bet it's a little harder than with an adult because the child doesn't know as much, right?
You have to be a human being.
Yeah, exactly.
You have to. I try my best to bring myself into the room, and I bring my own life experiences into the room, but also my interests, So like we were talking about before, I was a 3-sport athlete in high school.
Mm-hmm.
I played sports in college. I was a high school basketball coach.
Mm-hmm.
I play. I'm a percussionist. I play gigs. I do other things outside of here.
Yeah.
And I find that the best way to connect and build rapport with somebody is to show them who you are and to connect. So it happens to be that over time, I see a lot of athletes. I see a lot of musicians. Kids who do those things because it's relatable.
Yeah.
So you have to be a person first. Mm-hmm. And I think that the best way to build rapport is to show someone that you care and that you're interested. So it's interesting. You go through 4 years of undergrad, 4 or 5 years of a doctorate. In my case, 4 years of post-doctorate training. So how old was I? I was around 30 by the time I even had my license. So it took a long time. But all that training is great. It's valuable. It's important. But if a child sits in here and they don't think I care about them, and I don't remember what their friends' names are.
Mm-hmm.
I don't remember, that they had a game coming up or what we talked about the previous week. They don't know that I care about them.
Yeah.
So in many ways, the most important thing is for them to know I care. So I'll give you a little trick of the trade. I won't look at my watch while I'm talking.
Yeah, that's really important.
Right?
Yeah.
It's such a small cue.
Uh-huh.
But if you're saying something important to me and I'm going like that,
Uh-huh.
that's not building rapport.
Yeah.
So what I'll say is, I want to hear what you're saying. It's important to me, but I'm worried about the time. Let me just look right now.
Mm-hmm.
Which is a very different message than, that cue.
Yeah.
Right? So those are important small things.
That makes sense. How exactly do you remember all of your patients and everything about their lives? Like, is it just because you have such a deep connection with them, or is there like a technique you use or something? Because I myself am not the best at remembering names sometimes.
Sure. I mean, do you remember if you have a friend who calls you and they're like, "Hey, man, I'm not doing great."
Mm-hmm.
Would you forget their story?
No. Yeah, you wouldn't.
You wouldn't. So
Yeah.
it tends to be, I find that when you can invest yourself in someone's life
Mm-hmm.
and you care about them,
Yeah.
you don't have to struggle to remember because you're present in their life. And I think about it like I'm watching a Netflix show. It's like, now here's the next episode.
Yeah.
And I remember the last episode.
Mm.
Now, do I remember every little detail? No.
Mm-hmm.
And it's okay to not remember every detail. But do you remember the gist of things? Of course. And then you take notes. And then sometimes you have to brush up on it.
Yeah. Okay, that's really cool. So going back to this, how exactly do you involve the parents? Because you said that because the parents are there, that adds another level of stress. So how do you involve the parents in like this treatment?
They're very important. So the younger the child, the more the parent. This isn't a rule, but this is a general, I would say, principle. The younger the child, the more the parent is involved.
Mm-hmm.
For kids your age, maybe I talk to the parent once every few months, or young adults your age. But for younger kids, they're very involved, and they're involved in the skill development. So if you're 7, 8, 9, 10, the parent's often in the room, and we're working on the skill together. Or oftentimes I'll have the parent start the session. I'll work with them for about 10 minutes, 15 minutes. I'll get an update on the child's life. I'll hear what's going on. Then I'll remove them from the room, and then I'll work with the child individually. And then we'll wrap up together, and we'll set a goal for what they're going to work on between now and the next time we meet.
And do you tell the parent of everything that you discussed with the child?
It depends. If the child says, "Listen, hey, Dr. Bell, I really don't want you to tell my mom,"
Mm-hmm.
I'll make a judgment call. But I try to involve the parents as much as possible. So I try. It's an interesting thing to navigate because you want to maintain the confidence of the child while simultaneously bringing the parent up to speed. So that's an interesting balance that you're always navigating.
Yeah, that's what I was
that's
thinking.
Challenging.
Yeah, because obviously the child probably doesn't want their parent to know as much if they're dealing with something, and then the parent wants to know everything about the child because it's their child. So that makes sense. So finally, just about the children that you work with, could you share one particular success story that was super rewarding? I know you gave one, but just throughout your career, maybe if there was one that really stood out.
I have one kid now who really was. I've worked with this child. Was not a child anymore. He's in high school.
Oh.
But who's periodically gone through times of real severe mental health issues,
Mm-hmm.
been in the hospital and these kinds of things. And now he's, ready to take the next step, in his life and looking to apply to college and these kinds of things. And to watch him be ready to do that at a time where I didn't know that would happen. At one point in high school, I didn't know that he'd be getting through high school even, let alone going to college. So to see him overcome that is pretty remarkable. And I will say one thing, and I say this a lot, I don't know that I'm the mechanism of change very often. I'm not saying that just to be humble. I really mean that. I think that sometimes a person needs to be resilient, and when a person is resilient, they can overcome a lot. I really believe that.
Yeah.
And that doesn't have to do with me. I mean, I could say the most brilliant insight in the world, but if you're not receptive and you're not resilient, it doesn't matter.
Yeah.
So it's a pleasure to watch people be able to go from impairment to success.
Yeah.
And that was one of those examples.
And I obviously think that, of course, you're saying I don't think I'm the means, but as a patient, they probably feel much better, more they feel more motivated to be resilient when they have someone
Of
like
course.
you. Yeah. So
No, definitely.
so-
I'm not saying I don't serve a
yeah,
role
no,
on
but I
purpose.
understand what you're saying. Yeah.
But,
So
but
it's
people have amazing qualities.
I think a lot of times in any sort of like psychology, any sort of medical as well, like intervention, a lot of times it sits in the patients to make the right decisions and actually understand what you're saying and make an impact in their life.
Of course.
So yeah. So going back, so now we've talked about like patient care, your job, all those kind of things. So let's kind of like zoom out a little bit and just talk about mental health as a whole, right? So what advice would you give to individuals in society who, you know, want to kind of make a change for mental health? What do you think is one thing that they should know about mental health?
No matter how bad you think something is, 9 out of 10 times it'll be okay.
Yeah.
And I think sometimes we think that whatever we're going through is the end of the world,
Yeah.
but it's not.
Yeah. Okay.
And that's hard to remember sometimes.
Yeah, sometimes
For myself too.
Yeah, exactly. Sometimes for myself. I think it's because like, yeah, you're the one living your life. So sometimes when something like really important to you is not like working out or something, then you can feel. But thank you. And then what do you think, considering you work with children, what do you think like schools or maybe like, you know, communities that children are in can do better to support these children with these mental health issues?
Well, I think integrating social emotional learning curriculum into their basic professional development for teachers, I think is really important. It's what I did in graduate school. Like I was saying before, I do it now. I do a lot of professional development with school districts, teaching teachers how to incorporate emotional intelligence into their teaching. I think it's the best thing that a school district can do, starting from kindergarten. Every year, devoting periods of time where you're teaching emotional intelligence skills across the developmental span. By the time a child is in 7th, 8th grade, when a lot of the social demands are increasing, they'll have the ability to navigate them. And if you can navigate your social challenges, your likelihood of developing a mental health issue is much less.
Yeah. And how, if you could quickly just like describe how that works within the school, like how are the teachers explaining to their students emotional intelligence?
It's a great question. So in a lot of different, so it can be done in a few different ways,
Okay.
right? So it can be a standalone like class period where you're actually teaching emotional skills, like within the health curriculum. We've done that before. We've helped health teachers teach in those settings. But also, let's say a math teacher being able to take a mindful minute in the beginning of the class, that's an important technique. Or being able to share, being able to check in with students and ask them, where are you at emotionally right now? Are you emotionally available to learn right now? Or do you need to take time to get yourself right? Helping people check in with how they're feeling. With little kids, we call that what we do is we have an emotional intelligence vocabulary that we teach children. So what we'll say is, you have your emotion brain and you have your thinking brain. And sometimes your emotion brain can get so upset that it can take over or hijack your thinking brain. And when that happens, you can't learn. So being able to help children be self-aware enough, like I said before, about being able to know what you feel, being able to make a distinction between their emotion brain and their thinking brain, so that they can make a choice, like I said, but keep saying, about how they want to respond.
Wow. Yeah. I think that would actually really help.
Well, the research shows that it does.
Yeah. And do you think there's like, are there things in process right now to make that happen in schools?
Majorly, yeah, for sure.
That's awesome.
So I'll tell you something really interesting is that when children go through social emotional learning curricula, they actually have their SAT score. Their SATs or their grades. I think their grade point. They score 11 points higher on standard on assessments.
Oh, okay.
So their academic scores actually improve in a very tangible way, and that's what drew me to this. Is that when you do social emotional learning, it has the biggest impact academically.
Yeah.
Which is amazing.
Yeah, for sure. I mean, just in my school, I think that a lot of times when you're taking a test, like 50% of it is just like your mindset going into that test.
Sure.
Like for me, at the start of this year, I had calculus and I was like super terrified and I kind of did really bad on those first few tests. Then I just studied more, gained more confidence in like the material, and then I just did better, even though maybe I had the same level of understanding. So I think that is really important to discuss. And just finally, within like mental health advocacy, what do you think we can do to reduce stigma around mental health in our society?
I think what you're doing is a part of that discussion for sure. Making people aware that mental health is an okay thing to talk about. Personally, I think every child should have a therapist, just the way that we have a general practitioner like a pediatrician.
Mm-hmm.
And I think that we are going through a pendulum shift. I think 50 years ago, talking about anxiety or sadness was taboo. We're much farther away from that, although I think we've actually gone too far in the other direction. In many ways, we're almost too sensitive to it.
Yeah.
I think we have to be more resilient in many ways. But I think making it okay to talk about, saying to people, yeah, I'm in therapy, and that being an okay thing to say.
Yeah. Oh yeah, and also going back to what you said just really quickly about like we're completely going the other side, being too sensitive. So essentially, does the emotional intelligence thing that you were saying has worked in schools, does that kind of make students more aware but make them like understand that they have to be resilient towards the emotional brain?
Absolutely. So
Okay.
one thing I didn't share is that a lot of the emotional intelligence curriculum also have a character education component. So we talk a lot about courage as an example. So courage is being scared and doing it anyway.
Mm-hmm.
And that's what resilience is.
Yeah.
It's having courage. I actually, before you came in, I was just having this conversation with somebody that you don't always want to respond, like we even said in this interview, to what you feel. You want to respond to what you think.
Yeah.
Because a lot of times your feelings and your thoughts are in conflict. But if you choose how you think, your feelings will then shift and align with what you think. And then you're able to be more resilient. But if you just say, you know what, I'm too anxious, I can't do this, you're never going to improve.
Exactly. Yeah. And I've seen that, for me, just personally, I've seen that in running. Like, I remember my coach in freshman year, he would say, be comfortable with being uncomfortable. That was like his biggest quote. So
awesome.
yeah.
Awesome. That couldn't have said it better.
Yeah, exactly. So just wanted to end off with maybe a question or two. So first of all, what do you wish that more people understood about the job that you do in mental health care?
That it's not magic. It's hard work.
Yeah.
If somebody wants to get better, I believe they can.
Yeah.
There are three qualities that I look for to determine if I think there's going to be a good prognosis or not. I want to know, is there courage? Does this child have courage? If you don't have courage, it's going to be, I can't do much.
Mm-hmm.
Well, that's not completely true. I can help the parents.
Yeah.
But in terms of your own individual capacity to change, you have to have courage.
Mm-hmm.
You have to have self-awareness, the ability to know what's going on internally. And you have to have, so there's the courage, there's the insight into yourself. Then you have to be motivated. If you're not motivated, it's not going to work. So very often, the parents will be very motivated for their child to do better, but the child will come in and they'll be like, I don't want to be here right now. So they're not motivated. So it's very hard to help a child who's not motivated. But if you're motivated and you're courageous and you have insight, I really believe you can make change.
Mm.
And it's not magic. It's hard work, but it's possible.
Yeah. And then finally, just the last question, what are some simple techniques that anyone in their daily lives can use to improve and maintain good mental health?
They have to start with the basics. You have to get good sleep. You have to eat well.
Yeah.
And you have to work out.
Okay.
If you're not doing those, and running is a great, important part of mental health. If you're not doing those three things, it's going to be really hard for your emotions to follow suit.
Yeah.
I would also say to have realistic expectations of yourself. One thing I see, especially locally, we live in a pressure cooker in this area.
Yeah.
Academically, what you're going. It wasn't like that when I was in high school. I graduated high school in 2005. I do not remember talking about grades with my friends.
Oh.
But that's not the case anymore socially.
Yeah,
that's all people talk about.
Yeah.
Do you know where I went to college?
No.
That's the point. Did it matter to you when you had some? That's the point,
Yeah.
right? You didn't even look. but again, it becomes irrelevant at a certain point.
Yeah.
Right? But in high school, we think it's like the end all and be all
Exactly,
and everything, right?
Yeah.
So, what I would say is we have to ask ourselves, how are we determining our life success? Is it where we go to college? Is it the job we have? Is it how much money we make? If that's the case, I don't think that person who has those three things as their definition of life success, in my opinion, is never going to be happy, because there's always more money to make. There's always a better college. I have kids coming here and they're devastated by getting into Duke in Chicago, but not an Ivy League.
Wow.
And this is a typical thing. And I'm like, hello, you're good.
Yeah.
But I think if we measure our life success based off of the quality of our relationships, are we fulfilling our passions? Are we being our best self? We have a much greater likelihood of being happy and emotionally healthy. And that's what I encourage people to do. But that's my own soapbox. And in many ways, like I said before, in this area, it's a bit of an upward climb, but I'm fighting that battle.
Yeah.
So.
Okay, that's really inspirational. Just even for me, just hearing that really helped. Okay, well, that concludes all the questions for today. So thank you for everyone for tuning into this podcast. For anyone who lives near Morristown, New Jersey, and would be interested in potentially working with Dr. Perry Bell here for any mental health concerns, or if you're just curious to learn more about him, go check out his clinic's website at www.ccfdmorristown.com, and I'll put the link in the description of this video, and just search up Dr. Perry Bell in the staff section. And thank you so much to Dr. Bell once again for offering to be here and sharing your expertise. It meant so much to me. I learned so much here. And thank you to the viewers for tuning in. Make sure you follow, because I will be interviewing more individuals that are specialized in teen mental health. And I will see you all very soon. Goodbye.
A lot of fun.
Thank you.